Lymphedema, a condition characterized by swelling in the arms or legs, is caused by fluid accumulation in the interstitial tissues. Proper investigation and management are crucial for identifying the underlying cause and providing effective treatment. Below is a detailed overview of the modalities for investigating and managing lymphedema. Investigation modalities. 1. Clinical evaluation. History taking. Duration, onset, and progression of edema. Associated symptoms like pain, redness, or skin changes. History of trauma, surgery, infection, or systemic diseases, e.g., heart failure, kidney disease. Medications, e.g., calcium channel blockers, NSAIDs, family history of similar conditions. Physical examination, distribution of edema, unilateral or bilateral. Pitting, depressible versus non-pitting edema. Skin changes, e.g., erythema, hyperpigmentation, ulceration. Presence of varicose veins, lymphadenopathy, or signs of infection. NAR2, laboratory tests, blood tests, complete blood count, CBC, to check for infection or anemia. Renal function tests, urea, creatinine, to assess kidney involvement. Liver function tests, LFTs, to rule out liver disease. Serum albumin and protein levels for hypoalbuminemia. Coagulation profile to assess for thrombosis. Urine analysis, proteinuria as a sign of nephrotic syndrome. 3. Imaging modalities. Ultrasound Doppler evaluates venous and arterial flow, detects deep vein thrombosis, DVT, or venous insufficiency. Lymphoscintigraphy assesses lymphatic drainage and function, useful in diagnosing lymphedema. CT or MRI identifies masses, structural abnormalities, or deep-seated infections. MRI is particularly useful in soft tissue characterization. Venography or phlebography, direct visualization of venous system abnormalities. Chest X-ray helps detect heart or pulmonary causes in systemic edema. 4. Specialized tests, biopsy, for suspected malignancies or chronic infections. Genetic testing, for hereditary lymphedema or other congenital causes. Cardiac evaluation, echocardiography to rule out heart failure. Lymphangiography, rarely used but can provide detailed lymphatic system imaging. Management modalities. 1. General measures. Elevation of the limb reduces venous and lymphatic pressure. Compression therapy, compression stockings or bandages to prevent fluid accumulation. Skin care, prevents infections like cellulitis. Weight management, reduces stress on the venous and lymphatic systems. 2. Medical management. Diuretics, useful for systemic causes like heart failure or kidney disease. Antibiotics, for infections such as cellulitis or lymphangitis. Anticoagulants, for DVT to prevent clot propagation. Anti-inflammatory agents, for inflammatory causes of edema. Specific therapies, hormonal therapy for hypothyroidism, albumin infusion for hypoalbuminemia. 3. Physical therapy, manual lymphatic drainage, MLD, specialized massage to improve lymphatic flow. Exercise, promotes venous and lymphatic return. Pneumatic compression devices, mechanically assist in reducing fluid accumulation. 4. Surgical interventions, lymphatic surgery, lymphovenous bypass or lymph node transplantation for lymphedema. Vein surgery, venous stripping or endovenous ablation for chronic venous insufficiency. Debulking procedures, removal of excess tissue in severe cases of lymphedema. Bypass surgery, for arterial insufficiency causing ischemic swelling. 5. Lifestyle and preventive measures. Avoid prolonged standing or sitting, prevents venous stasis. Hydration, maintains proper circulation. Avoid tight clothing, reduces constriction of lymphatic and venous flow. Smoking cessation, improves overall vascular health. 6. Psychological and social support. Address psychological distress caused by chronic edema. Support groups for conditions like lymphedema. Differential management based on etiology. Venous insufficiency. Compression therapy. Vein-specific medications or surgery. Lymphedema, MLD and compression garments. Advanced lymphatic surgery in refractory cases. Infectious causes. Targeted antibiotic therapy. Abscess drainage if necessary. Systemic causes, treat underlying conditions, e.g. heart failure, renal failure. Post-surgical trauma edema, elevation, cold therapy, and physiotherapy. Early and accurate diagnosis, combined with a multidisciplinary approach, ensures optimal management of lymphedema and prevents complications.